should everyone fast? How often should people fast, and how long should each fast last?
We really have to re-examine our relationships with food in general. Throughout history, food has been a matter of survival, and a full stomach is a treasured possession. Now, however, in modern Western society, food is everywhere, and eating has become a recreational activity, and it's just become our national sport, and our bodies certainly reflect that. And so for this reason, in that context, most all of us would benefit from a time out from eating. I think in general, because of who we've become and our relationship with food, it would be wise for all of us to take a break. So 3 days on water, 5 days on water would do us all good. And there is a philosophy of intermittent fasting, where once a month you do 3 days or 4 or 5 days on water. And during this time, the body starts that remarkable clean out phase and rebalancing phase. And so the intermittent fasting movement is gaining quite a bit of momentum. And again, the same caveats apply. If you've got kidney failure or type 1 diabetes, then you shouldn't be doing that. But if you don't have any serious medical conditions, most everybody can and probably should do a brief fast on a fairly regular basis once a month, and I think we'd all be healthier for it.
What health challenges does water fasting work for, and which does it not work for?
There are some patients whom water fasting is just remarkably effective, and we use it frequently in clinical settings where we want to avoid powerful drugs and surgery. Classic examples are runaway high blood pressure. On a water fast, blood pressures come down. It might take a couple of weeks, and we have these heavy-set guys come in with blood pressures of 220 over 110, and they often have to do a 21, 30-day or up to a 40-day fast. But you can't hold high blood pressure on water, and the days go by, and we're checking them twice a day, and day 15 it's still 220, day 18, and then you come in on day 23 or 24, and boom, 110/70, enough water has left the systems, the arteries are starting to relax, and the pressure just comes down. The inflammatory reactions throughout the body really get dialed back on a water fast. So folks with bad inflammation, rheumatoid arthritis of the joints, psoriasis of the skin, the generalized autoimmune inflammation of lupus, ankylosing spondylitis, these respond beautifully to water fast. We've seen severe eczemas fade away in the skin. As I mentioned, migraine headaches, boy, it all turns them off like a light switch. And asthmatic lungs, they come in really wheezing. Well, you stop the dairy and the wheat and everything else that's just keeping this thing going, and the lungs clear up. So things that have an inflammatory component seem to respond exceptionally well to a water fast. There are some things that just don't respond. Someone has an advanced dense tissue cancer, a sarcoma of the bone, or a lung cancer. A water fast really isn't going to change that as far as I know. As I mentioned, folks with muscle wasting diseases, ALS, multiple sclerosis, muscular dystrophy, water fast would not be indicated. And also people in advanced kidney failure. Fasting is hard on the kidneys because as the tissue cells empty out their wastes into the bloodstream as they burn down their fat tissues, well, all those wastes go right to the kidneys and right to the liver. So fasting can be stressful on those two organs. So if you have already liver failure or kidney failure, you shouldn't be doing a water fast. So there are some conditions that you have to be selective in choosing your patients, but that's why you want to be a facility where there's experienced clinicians who know how to supervise a fast, and those problems come to the fore pretty quickly.
Does fasting get rid of pathogenic bacteria in your gut?
One of the remarkable trends in medicine over the last 5 to 10 years has been this skyrocketing awareness of the importance of the microbiome, those trillions of organisms that live in our intestinal tract. And there's no question that the food we eat determines the microbes that live in our gut. If you eat a bunch of sugar, you're going to summon up sugar-eating microbes. You eat meat every day, you're going to summon up carnitine-eating microbes. Not necessarily friendly guys, but clearly the food determines the microbes that occupy our intestinal tract. Well, what happens when you stop the food? What happens when you're just drinking water? Surely the microbiome organisms change. They must, of course. How do they change? We're not sure yet. We're just getting into this. And at True North Health Center, it's about an hour north of San Francisco, they are starting to do this very thing. They are taking their fasting folks and they're collecting stool specimens on them once every other day. And they're sending them off to the lab to see what is happening in the microbiome. So clearly things are changing. Surely the way that the inflammatory reactions dial down, that's probably related to the microbe changes in the gut because they're a major player in systemic inflammation. So we're just at the embryonic stages of answering that question. What does happen to the microbiome? It's going to be fascinating for both the insights it yields as well as the opportunities. What if we, in the middle of the fast, why don't we introduce that organism? And so it's in their gut on the way out of the fast. There's all sorts of possibilities, but we're just learning about them. Stay tuned. It's the whole frontier of medicine.
Does fasting get rid of Lyme disease?
Does fasting get rid of Lyme disease? My honest answer to that is I don't know, in that I'm not a Lyme specialist. There are clinicians who spend their entire careers now studying this remarkably frustrating, subtle, powerful condition called Lyme disease. Now, surely fasting affects everything in the body, and it's going to affect the Lyme organism. One reason, one theory at least, why Lyme organism is so hard to eradicate is whether it exists in so-called biofilms, whether the microbes wave their little flagella and condense a little cloud of protein out of the blood from albumin and fibrin and make a little protein nest for themselves, and they live in there. And so antibiotics don't penetrate in there, and white blood cells have a hard time getting in. Biofilm medicine is a whole other issue. Well, how does fasting affect the biofilm? That should be a fascinating subject. And of course, the only way to do it is to do the study, is to get some real official Lyme patients and fast them and see what happens. So it could be potentially a very powerful tool, but we just don't have the solid data on that yet. Stay tuned.
If fasting is so effective, why doesn't the FDA or medical industry embrace it?
Indeed, if fasting is so good, why doesn't the medical establishment embrace it? What a wonderful question. If fasting is so effective, why doesn't the medical establishment embrace it? Fasting itself frightens people. Oh, I'm not going to eat. I get upset when I miss lunch. You're telling me that I'm going to eat for 3 days, for 5 days. You know, it's so out of people's reality sphere that the prospect itself is frightening to them. But my profession is so far behind where it should be, in that, no, they don't want to have a good look at fasting. Fasting, they don't want to even look at a healthy plant-based diet that makes these diseases go away. If they would just see the effectiveness of eating a diet that our simian body was really meant to digest, to see these diseases reverse and fade away, that's what they should be open to. That's why with our Moving Medicine Forward initiative, I'm going to the medical schools and telling the students, look, these diseases go away with a whole food plant-based diet. And we're trying to get those wheels turning for that to be accepted. Once they do that, then we could say, now there's another aspect that would help this work even better. And I'm glad we're talking about this, because water fasting is a remarkable, powerful modality to gain control over troublesome symptoms, to lower runaway high blood pressure, cool off inflamed joints. But it's a temporary fire extinguisher. One, you can't stay fasting, obviously. And the most important thing is not the fast, it's what you eat after the fast. Because if you do this wonderful 21-day fast, and the joints are better, and the blood sugar is better, etc. But then you go right back into chicken and cheese and olive oil land and eating your burgers and fries. Oh, Cinderella turns back into a pumpkin within days. It's shocking how quickly everything comes back. And the joints start hurting, and the weight comes back, and the blood pressure goes back up. The fasting is just a jump start into a whole food, plant-based diet. The real cure, the real therapy, the real improvement happens with the food you eat after the fast. And at True North, even though the person is fasting, we're sending them down for cooking classes, we're watching nutrition videos, we're watching Dr. Furman, Dr. Goldhammer's videos. So when the person leaves the fasting state, and they go back home, we want them to know what to eat. There's two areas. One is when they're pushing that cart down the supermarket aisle, what are you going to really put in the cart to bring home? And when you're sitting in the restaurant with that menu in front of you, what are you going to order that's going to make you healthier and not more ill and inflamed? And so the important thing, again, is what you eat after the fast. So the fast is a jumping off the platform into a whole food, plant-based diet. And that's what provides the healing magic. It's the food washing through your tissues day after day, week after week, month after month. If it's full of soups and salads and rice and beans and lentil stews and bean chilies and mangoes for dessert, people get lean and healthy on that food, and these diseases go away. And so that's the larger picture perspective to have in mind. The fast is a jump start into a whole food plant-based diet, and that is what is going to give you complete remission from your medical problems.
Have you received pressure from the medical establishment about these teachings that you're doing, folks that are not on board?
To this date, there hasn't been active pushback, because the truth is the truth. I'm embarrassed for my profession, their ignorance about this very, very important modality. And that translates into me giving lectures in front of the medical students and the young residents. And always in the back of the room, there's a row of older white-coated specialists with their arms folded, very skeptical, and well, my patients are never going to do this, and I don't know anything about nutrition, and show me a 1,000-patient study that really helps. And so there definitely is resistance in that way, and it's sad if they're really seekers of the truth. And you can show them pictures of arteries opening up and blood sugars on diabetic folks coming down and joints that haven't moved for years suddenly get their mobility back. I would hope every specialist, every cardiologist, every rheumatologist, every pulmonologist, every dermatologist who sees these dramatic improvements from a whole food plant-based diet would say, stop the presses. What did you do to create this remarkable improvement in this patient? Tell me, I want to learn about this. If there were true seekers of the truth, that would be the response. But it frightens people, they don't want to change is a frightening thing. And there's a large monetary investment in keeping things the way they are. And so there's absolutely resistance. But at my stage in my career, I've got nothing to lose. And I love my profession too much to let it continue with this, I have to be careful of my adjective, untruthful, inefficient, incomplete kind of medicine, to have a cardiologist have a patient in front of them with clogged arteries and angina. You can keep eating your pepperoni pizzas and your cheeseburgers and your buffalo wings, Joe, but take your statins and come back in a couple of months. To me, that's bankrupt. And Joe will go on to have his heart attack or his stroke because he's loading up with all this fat and protein and oil and sugars. But the cardiologist, oh, well, I had him on statins, I did my job. But the statins just poison the enzymes in your liver that keep you from making your own cholesterol. But if you're eating all this other cholesterol, the statins aren't going to help that much. So I'm for an honest medicine, for a completely open medicine. We owe this information to our patients. The Statement of Ethics from the American Medical Association mandates doctors to stay abreast of the latest changes in medical science and to share this information with our patients. We are obligated to tell our patients about this. So at this point, there's nothing better I can do with my medical career to play Johnny Appleseed and scatter this information into the heads of these young docs so they understand it's what your patients are eating. That's square one. Start with that and everything else starts to make sense.
Does fasting prevent wrinkles? Does it get rid of wrinkles?
Fasting to get rid of wrinkles? I don't believe so. But again, we haven't really done the study, and it would be a fascinating study to do. The fasting creates stem cells throughout the body, bone marrow, muscles, and skin to wake up after 5 days on water when the fruits and vegetables start washing through the tissues and the phytonutrients and the fructose and glucose goes through the cells. Whoa, our stem cells wake up, and there is a youthening kind of effect. Will it make wrinkles go away? I don't know. That's mostly a matter of both tissue damage, how badly the skin's been damaged, and your level of water hydration has a lot to do with those. But it'll certainly be healthier skin. It'll be less wrinkled, don't know, but it'll be less likely to develop skin cancers. It'll be less likely to develop more wrinkles. So it's always a good thing to do the occasional fast, but the wrinkles will do what they're going to do.
Does water fasting help prevent dementia?
Does water fasting help prevent dementia? Another fascinating question, a legitimate question, and one that should be investigated. These kind of studies are difficult to do because, of course, you have to follow people on for 20 years, 30 years. And the issue, fasting is nice, but what are they eating in between the fast is by far the major concern. Because it's clear now that all dementias, whether it's true Alzheimer's dementia or vascular dementias, whatever it is, they all have a vascular component. Their blood vessels are involved. And it's the tiny capillaries bringing blood and oxygen to your brain cells that you want to keep open. But if we are eating the standard Western diet and bacon and eggs for breakfast and cheeseburgers for lunch and chicken for dinner and ice cream for dessert, that kind of dietary style every few hours sends waves of cooked animal protein and saturated fats and hydrogenated oils and concentrated sugars and chemical additives through our blood vessels and our brain cells. Surely that must be playing a role in the development of dementia. And again, it's the whole food plant-based diet that I think is far more important as far as preventing dementia. But that said, a intermittent water fast probably opens up blood vessels and increases blood flow to the brain and helps the brain clean out waste tissues, waste molecules. So it probably has a benefit. Whether it's going to make a discernible difference, the fasting, compared to a whole food plant-based diet, it might add a bit of benefit. But until I see the studies that have actually been done, I can say it's the food, it's the food, it's the food. It's what you eat in between the fast. It's bathing your brain with all the stabilizing, antioxidant, tissue-repairing phytonutrients that's in the green vegetables and the yellow vegetables and the fruits. That's what really keeps your brain cells healthy. The 5 days on water, 7 days on water, it probably spruces things up a bit, but again, it's the food that you're eating, washing through those cells. That really is what keeps your brain cells healthy. If you don't change where you're going, you're going to wind up where you're headed.
How long do the benefits of fasting last?
The benefits of fasting certainly last during the fast, and I've done 7 and 10 day water fasts, and by day 7, the fasting experience is so remarkable. People think, oh my God, I'm not eating for 10 days. Are you kidding? I'm going to be eating the wallpaper. Actually, that's not what happens. The body is so wise and so merciful that after 48 and certainly 72, 96 hours on water, hunger is gone. You're not hungry, the vast majority of folks. It's God's gift to fasters. You don't spend 21 days hungry. And the energy that we usually use to digest our food on a fast is freed up, and people feel it. And they feel energetic. They're up at 3 in the morning balancing their checkbook. They stop me in the courtyard. Doc, I haven't felt this good in years. I haven't eaten in 3 weeks. I feel wonderful. It's counterintuitive. You think you're going to be tired and cold and hungry and whimpering on the bed. And the opposite is true. You're not hungry. You feel light and energetic. So So it's not that hard to get through a long fast. You should be supervised. But even these 4 or 5 day fasts that you can do at home, people shouldn't go into them white knuckled. Actually, especially the more you do, the easier it gets, and you won't spend 5 or 7 days hungry. Now, that said, you asked, well, how long did the effects last? Well, I would do a 7 or 10 day water fast at True North. Boy, by day 7, by day 10, I felt really good. Wasn't hungry, felt energetic. Eating was a bring down. I didn't want to eat because I knew I wouldn't be feeling as energetic. But you start, and again, you don't break a fast with a big piece of tofu lasagna. You start off with just some vegetable broth, and you can do a little fruit or a vegetable soup, some blended squash. You want to just gradually increase the fiber content over 5 days or so. So with a very gentle, careful refeed, you'll have that fasting euphoria last for a good another 3, 4, 5 days. In fact, the best part of the water fast is often just when you've broken it, and those phytonutrients are just starting to wash through your cells. I've had patients who feel like Superman. Doc, you didn't tell me how good I was going to feel after the fast. And there's some good biochemistry for that as your cells get those nutrients that they were looking for. So yes, there's definitely an after-fast glow. Lasts for a good 5 to 7 days, but again, depends what you're eating. If you're staying on the straight and narrow with soups and salads and steamed veggies and lentil stews and bean chilies and Indian vegetable curries and all the wonderful cuisines and lots of fresh fruits and vegetables, you should continue to feel light and healthy. If you get dragged into all sorts of breads and pastas and cream pies and heavy meat, dairy, processed foods, then boy, within 96 hours, you're going to feel, uh-oh, gee, that's starting to hurt again, and boy, I'm feeling pretty loggy again. And again, Cinderella turns back into the scullery maid at that point. And it's sad, but you can always do another fast. And your body is, your body's never not looking. You can't tell your body, look over here and have a cheeseburger there. Your body's waiting for what's coming down the next meal. That's all it cares about. And if you mess up one day, fine. Don't say, well, I can't do this. I might as well eat everything. On the contrary, learned a lesson, didn't like the way that made me feel. I'm going to eat clean today and have that oatmeal for fruit for breakfast and have big salads and soups for lunches and dinners. And your body will forgive you, and it just wants you to treat it nice meal after meal. That's the most important thing. Headaches are semi-common, and the vast majority of those headaches is some form of caffeine withdrawal. The person either likes their coffee or their tea or the chocolate, or it's usually caffeine withdrawal headaches. And in fact, at True North, we tell people, stop your coffee about 10 days before you come in. Go through that at home. We don't want you sitting up in your room holding your head. Go through your caffeine withdrawal headache beforehand. And that's most likely what's going on. So if you know, and you should treat this fast as kind of a sacred experience. But set aside the time. You're going to do a 3-day fast, then clear the weekend from Friday to Monday. I'm going to take care of myself with this water fast. And you don't want to do a lot of physical activity during a water fast. You don't want to burn your blood sugar down. That energy is for you and for your tissues to restore themselves. So allow enough time, and you might be hungry for the first 24 or 48 hours. You will break through that, and by day 3, hunger is pretty much gone. One thing that's often helpful to get through that early hunger phase is, as long as you're drinking water, it's okay to make it carbonated water, sparkling water, and that fills up your tummy, a little extra gas there. And I find it very satisfying. Got me through those first days of my fast last time. So just keep sipping that water and go through. And a lot of folks think they're going to have a caffeine withdrawal headache, and they don't. So it's hard to predict, but go through that. But that's what's going on. Stop the coffee or et cetera, a week or so before the fast, and you probably won't have the headache then.